Today's music, Hot 92.1, a Connecting Hearts interview as Hot 92.1 and Conemaugh Health System, along with the Cameron County Drug Coalition, present Connecting Hearts. And today we welcome Kim Gorman to the studio. She's a nurse practitioner with Conemaugh Trauma Services. And Ms. Gorman, we talked before we went on the air today. How long have you been a part of this program?
With the Fatal Vision program itself, about 2 years. Been trying to get the information out there on the alcohol education for all walks of life, including teenagers and through adults.
Let's talk about, you have seen up front. What is that like for you?
A lot of the time when you see the devastating effects that alcohol plays an impact in people who are driving, or even just people who have gone out, consumed alcohol and had accidents, that some of the devastating effects is what affects you most often when you, at the end of the day. But there is a lot of things that we can do in the hospital, and that's what we focus on, is how we can help you now that this accident has occurred.
Oh, what are some of those things?
So the first thing that we do, first of all, take care of the traumatic injury. You know, make sure that the patient's safe, make sure that their injuries are cared for. But we start out right from the beginning with alcohol education and making sure that that person doesn't go into what we call alcoholic withdrawal or alcoholic seizures, which is something that can really compromise the patient's care while they're in the hospital. In addition to that, we have alcohol educators that come in and they talk to the patients in addition to the trauma team, and enforce that maybe their alcohol is driving a lifestyle that may cause them more harm, and the next time it may be more devastating. So we get the education on a board right away so that they have options as to what they can do once they get out of the hospital for treatment plans.
Tell me more about the alcoholic seizures. That's something like for a lifetime of drinking, or is it something that you can have for, how long would that something like that take to occur? Tell me more about this.
So the alcoholic seizures, you don't have no one has a good feel on when someone would have an alcoholic seizure, okay? So it could be that you drink consistently every day, just a couple beers, and then you stop for a couple days, you could have a seizure.
Wow.
You can stop for one day and have a seizure. It's something that we just don't know. There's a lot of things that go into play when it comes to alcohol and the withdrawals from alcohol.
Because your body kind of just gets used to what you're giving it. Wow, that's fascinating. So for someone like, for a younger person, college, first time out, what would you tell them about the drinking lifestyle?
So I don't ever discourage anybody from having a single drink or having just a social drink. It's when you go in more to having those drinks that are continuing to make you more drowsy, more risk behavior. Those kind of behaviors will continue on as you continue to drink. So you want to avoid binging, if you will, on alcohol, especially like on the weekends.
Right.
And that's typically what happens, is on the weekends you go out with a bunch of friends and play games, and you end up getting hurt.
And the difference between binging is a different number for everybody, because you see these like things sometimes like it's 6 or 7, it's 4. But if somebody's not used to drinking at all, it could be 2 or 3.
Correct. And it also depends on your body size as well. Thinner, smaller person is going to be affected more quickly than a bigger or larger person.
But as people say, after the first one, you're working on impairment already.
Correct. And we have a pair of goggles here that shows you just that.
Okay, we're gonna have to get a video of this online once we're done here. But these are the Fatal Vision goggles.
Those are, yes. That is blood alcohol of 0.6.
So roughly how many drinks are we talking here?
Probably 0.06, sorry.
See, now, I've been looking... Okay. I've been looking at these screens now for how many years? 10, 12 years now? Okay, here's our copy for... The copy I just read to get in this interview. I can't read it right now at all. Oh, wow. So now, there you are. So where do you use these goggles for?
So when we go out to community events, we have the varying degrees of alcohol consumption or blood alcohol levels that we have each person try the different levels on, and then we have them do activities. Sometimes it's seeing the blinking light, sometimes it's catching a ball, sometimes it's just walking a straight line. And it depends on which group we have and what all they want to do with it.
So this is the lowest you have.
That is the lowest.
All right, let's jump up to the highest and we'll...
All right.
Okay.
There you go.
Oh, this is not going to be good. Okay. All right, we got... Okay. This is 0.25. Yeah, no. I couldn't even no, there's no way I could conduct this interview at all because I have buttons to push. There's no way. Wow.
So there are people that come in with a high alcohol level, such as 0.25, and you can see, or you can't see, what it impairs. on them as far as driving, even walking, getting up to walk or to find your footing or to grab onto something, you're going to end up falling.
Well, I mean, this is something I've been doing every day for over a decade, and I can't even see the buttons right now. Wow. Oh, that's amazing. Well, thank you for coming in and for bringing all this stuff, and we're going to get some videos online and show this off, and for the amazing work that you do every day.
We love coming out to the community. Thank you.